So I'm Associate Professor Dr. Ahmad Zamir BG Daud. I'm the President for Malaysian Occupational Therapists Association, as well as lecturers at Universiti Teknologi Mara. So the landscape, referring to the patients, so the landscape of occupational therapy in Malaysia as well as India is quite similar. So we have a shortage number of occupational therapists. In Malaysia, we have around one occupational therapist per 10,000 population. Similarly, like India, but the gap between India and the per 10,000 population is huge as compared to Malaysia, because like 0.2 OD per 10,000 population in India. So the landscape is, what I can see is there's a lot of occupational therapists practicing in pediatric arena, because there is increasing number of children diagnosed with developmental disabilities, including autism, ADHD, learning disability, and many more. And what we can learn, the occupational therapy simulation can learn from IGA is actually the creativity of Indian occupational therapists in using workplace or modalities for the children with autism, although you have very limited resources in India, right? So what can Indian occupational therapists can learn from Malaysian occupational therapists is the integration of technology in the intervention or treatment session. So as we in the era of technology, so as occupational therapists, we cannot just rely on the traditional method or manual therapy, but we need to incorporate technology in our rehabilitation service. So I always remind Malaysian occupational therapists not to ignore artificial intelligence technology in the rehabilitation. Alright, that's very important, because if we ignore the technology, we will be left behind. To answer the question, I think that SRM University play a very important step that gather all occupational therapists around the world for the international conference on autism, so that during the conference we can actually exchange the evidence, exchange the way we practice in Malaysia, in India, and other parts of the world.